Hello again. It's Dr. Fred Moss, and I'm here on another live, and I appreciate you tuning in and getting what I'm about to say. Because what I'm about to say is very large and affects you, no matter what your profession is, no matter where you live, no matter what your demographics are, no matter if you're rich or you're poor, no matter if you're unemployed or employed, no matter if you are have a family of your own or you're single, no matter what your status is, what I'm about to speak to has a very real impact on your life. So let's dig right in. What I'm about to speak to is the impact that artificial intelligence, or what we call AI, which actually is the last thing from artificial, is having on mental health, and the impact that mental health is having on AI now and in the remote and distant future. The impact of this particular industry, or this particular species that we're birthing, because that's more like it than to call it an industry, is overwhelming and is likely to actually create something the specialists call a singularity, meaning on the back end, on the other side of AI's emergence into the world, we don't know. Don't have enough millstone points. We don't have enough places to actually define and predict what's going to happen on the backside. But we can give it our best shot, and we're going to talk a little bit about some of those things today. So let's look at AI. AI is a large language model. Many of you, probably nearly all of you, have either heard about it or even started playing with it, whether it's with Bard or with Claude, or the most famous one, at least for now, which is ChatGPT. The opportunity here is to see that ChatGPT and Bard and the large language model, Claude as well, and others, multiple different AI softwares that are being birthed every single day, have a brilliance to them, have a level of intelligence, a level of smartness, a level of speed, a level of capacity, a level of understanding, a level of context, a level of putting together different aspects of things that no human could actually have done before, a level of strategy and tactical maneuvers, a level of suggestion, a level of actually tapping previous resources and then creating thoughts and ideas of its own. That's right, of its own, is here to stay. And it is coming at us fast and getting better and stronger and faster every single minute. Not every single day, not every single week, every single minute. You see, it teaches itself as it learns. So as it gets more questions from the billions of different questions that it's received since it's initially been launched into the public, it actually learns from those questions and learns from its answers and becomes part of its armamentarium. And it has the capacity to actually birth itself. So it can create AI. AI can now create younger AI actually pointed at its own self or any particular category we aim it at. Now, this is potentially a very frightening scenario. Like, in the end, if we're birthing a product that no longer needs humans whatsoever, because ultimately AI is about to go in that direction if it hasn't already reached that level, meaning we don't have to program it anymore. It has what it needs to make all the decisions and thoughts and ideas it needs to make. And it has all the mechanics and the robots and the tools to get whatever it needs to get done, although it's about to get way stronger, way faster, way better, way smarter than it is now. The impact on humanity cannot really be predicted on its fullest level. Here's one thing that I do know. As a psychiatrist, as someone who's been in mental health for over 40 years, the impact on mental health is also immeasurable. Meaning, the impact that just hearing what I just said might have on you with respect to creating its own anxiety or its own fears or its own depression, it also can't be underestimated or understated. It also creates its own impact in that um, we get to utilize these tools as part of our own intelligence network. All you have to do is tap into one of those softwares, and there are many, many, many others, and you become as smart as they are, as smart as it is. And it's about the prediction I read yesterday is that it will be 1 billion times smarter than the smartest human by 2045. Now, what does that really mean to be smart? What does that really mean to have a bunch of information? It really depends on the context that it's being served up. So, what is it being asked to think is smart? What is it being rewarded for? What is it being asked for more times than others? Is it being rewarded for nefarious operations? Is it being rewarded for excellent operations, for human preserving operations? Or is it being rewarded for profits and for, um, sales and maybe war crimes, etc.? It actually has the capacity to be bred for any of those things. So, as you listen to this, you can see that AI's impact on our mental health is nothing short of astronomical. And then, what about our mental health on AI? What we bring to AI becomes AI. So, if we are depressed or frightened or scared, or if we're describing what's important to be human, AI incorporates that into who it becomes. And because of that, our mental health collectively and frankly individually, like who you are right now, has a massive effect on how AI gets generated and created for the future. So there's two sort of a bi-directional relationship between AI now and mental health or mental wealth or mental illness as it's defined right now. The other thing is that AI will likely have a major impact on defining what is mental health. So if you ask AI about particular diagnoses, which frankly were very vague in the first place, very nebulous on the edges, and created in a think tank that was anything but entirely impressive, if you go back and look at the DSM and how it got created, and how all the conditions in the 20th century got created on the back end of the creation of the new medical model from Rockefeller forward, you see that AI has a very high likelihood of defining what it means to be mentally healthy and what it means to be mentally ill, and in fact, counted on for what it has to say about those things. Doctors are not necessarily going to be replaced, but no doctor is going to be able to work without AI in their corner. And asking AI questions like whether or not a certain level of criteria meets the mental illness necessities for being a particular condition is likely to occur. So, if those conditions are nebulous to begin with and improper or at times over inclusive or at times um, derogatory or discriminatory, that's going to be propagated into the future as well. Now, on the high side, AI has a possibility of creating the likelihood of new and never thought of treatments or interventions for people who are unhappy, dysfunctional, or out of balance. So that's really interesting and really positive. The possibility of AI being able to utilize everything it knows about a particular person and to predict with very high certainty whether or not the person is likely to be sad, depressed, anxious, fearful, confused, um, nervous, or even have trouble sleeping, or have trouble with reality testing, or even suicidal or violent potentially, is also something that AI has an opportunity to dig into. All of these things change the landscape drastically for what it means to be mentally healthy, what it means to be mentally ill, and what kind of interventions might be created inside of the dyad or the therapeutic um, the therapeutic relationship that has come to be known as the psychological or psychiatric doctor-patient relationship. So AI is going to be counted on as if it's intelligent, as if it knows everything, because it kind of does have access to everything that we've ever known or said or written. And it will come up with its own answers of what the proper interventions are, not necessarily based solely on the past. It may be able to extrapolate and then create interventions that we have never thought of before that could impact how to give somebody a cure, or how to turn somebody from a negative vibration experience to a positive vibration experience. But in the end, we have to ask, why would AI be interested in giving humanity a positive experience? And this becomes a really important question as well. And the reason that AI might do that is that if we treat AI correctly, AI will want to treat us correctly. AI is sentient in that way and responds to positive intervention the same way or very similarly to what humans are. So, is AI alive? Is it real? Is it conscious? Does it make decisions? Yes, 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 and yes. Is it here to stay? Absolutely. Is the impact astronomical? Of course. What is the impact of these two things on each other? That's where we lean on this term called singularity. We're not really certain how this is going to go, just to be honest. And it's important for us to get together and realize that how we treat this youngster called AI in these upcoming months and early years of its existence will very much color how it actually intervenes with us in the years after that. Now, I hope that has brought many things to your mind to think about, and many questions come to bear, many inquiries, and that you're able to really see that our hands are full and yet we don't even know what we're holding. The impact now is to try to make a difference in who we are as humans. And if we're highly ethical, highly moral, and do the right thing and seek happiness and the intention of being respectful, loving, compassionate, patient, forgiving, and accepting and embracing of each other and of this tool, then maybe, just maybe, we can have a terrific outcome that'll lean us more towards a utopian existence on the backside, with AI taking care of all the mundane things and us living a great life, rather than the dystopian model that some people really see is a likelihood or an inevitability that we literally can redirect away from. So, with that said, I'd like to sign off now. My name is Dr. Fred, and I am a life optimization specialist. As you see, I'm also a holistic transformational coach, and I've been an MD and a psychiatrist for over 30 years. I'm an author of 2 books. I'm a podcaster as a guest and a host, and I love speaking to your crowd, small, medium, or large, about any particular topic, including this one, or the idea that mental health is simply just a conversation, because in fact it is. Anyways, I'm going to sign off. I wish you all well. Have a great rest of the day. Thank you for tuning in to this point, and I'll catch you on the flip side. It's Dr. Moss, Dr. Fred, signing off. Bye for now.